Hi everyone, my name is Suvneet Bhullar, and I'm very excited to be here today to present my project on enhancing healthy eating, physical activity, and social emotional development within Strong Start BC centers. I would just like to start off this presentation in a good way by respectfully acknowledging that I'm joining you today from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations, who have inhabited and cared for these lands in time immemorial. I did my practicum with Child Health BC. I just wanted to give you a little background about what Child Health BC is. Child Health BC is a provincial health improvement network within the Provincial Health Service Authority, and Child Health BC focuses on improving the experience and delivery of health services for the children and youth across British Columbia. Within Child Health BC, there were already two existing programs when I joined, Appetite to Play and Feelings First. Appetite to Play is a provincial initiative which builds the capacity of early years providers and parents and caregivers to promote healthy eating and physical activity with children from birth to 5 years of age. And then Feelings First focuses on building the capacity of parents and caregivers to promote healthy social and emotional development with their children. Child Health BC proposed a pilot initiative to integrate these two resources into programming at select Strong Start BC early learning centers. Strong Start BC is a long-standing provincial initiative supported by the Ministry of Education and Childcare, and this program is aimed at providing rich learning environments for children in their early years who are accompanied by their parents or caregivers. And Strong Start BC promotes kindergarten readiness. They're also looking at the same age group as Appetite to Play and Feelings First, which is a 0 to 5 age group. In the pilot itself, 25 Strong Start BC sites were selected. Were selected, and they were selected based on the highest vulnerability for physical activity, healthy eating, and social emotional development. And once the foundational framework of the pilot was established, this is when I began my practicum. I focused on identifying evidence-informed strategies to enhance its implementation and effectiveness in addressing key public health priorities related to healthy eating, physical activity, and social and emotional development. I began with the literature review to gain an understanding of the topic itself and also to provide a high-level overview of evidence regarding early childhood programs that promote these three topics. And I was really looking for parent participation programs, which are similar to Strong Start BC, for children aged 0 to 5. During the time of my practicum, I was able to do a rapid review using the ERIC database and with the help of the Child Health BC librarian. The inclusion criteria included peer-reviewed studies from 2014 to 2024, articles in English. What wasn't included were studies prior to 2014, school-age children, children over the age of 5, non-English articles, and grade literature. I was able to identify 67 articles in a 3-stage review to narrow down to 50 articles that were included to inform the decisions for this pilot. I just want to briefly provide a list of some of the programs that I looked into. In the process, I was looking for healthy eating, physical activity, and social emotional development programs separately, but found that a lot of programs focus on healthy eating and physical activity together. But there weren't that many programs that targeted social emotional development. So that was one of the findings and things that I learned during this practicum. In the next few slides, I'll be talking about the literature and how we use the findings to shape our program. One of the key findings from the literature emphasized the importance of providing educators, our Strong Start BC educators, parents, and caregivers with clear, actionable strategies to enhance engagement and learning. And a strong example of this that I found in the literature was Sustainability via Active Garden Education Program, SAGE, which integrates healthy eating and physical activity through a structured, hands-on gardening approach. The SAGE program provides step-to-step guidance, ensuring that the activities are easy to implement. And one of the key strengths of this program is its concreteness. So the educators were offered clear and structured activities that directly connect gardening experience with their learning outcomes. In light of these findings, we thought it was very important for our educators to be equipped with the right knowledge rather than us just providing the links to the website for ATP and Feelings First. Based on this, we were able to provide comprehensive training for educators when they first onboarded into this pilot on how to incorporate Appetite to Play and Feelings First into their program. All facilitators participating in the pilot project completed the following training, recommended by the master's train of ATP and Feelings First. So the first step was to provide that training, but research suggests that initial training is not enough. I want to highlight two programs that I found in my literature that went beyond just the initial training. So Healthy Start, Depart, Santé, and Munch and Move. These two programs included training sessions, but then they continued to offer resources such as manuals, guides, posters, videos, and more. And not just that, support visits from healthcare professionals were provided, and fact sheets for communicating with families were also provided. So they were being properly equipped with all the tools, and these programs were proven to be effective due to the high engagement level. So in light of those findings, beyond just the initial training, I played a key role in ensuring that our educators had continued mentorship and support to successfully integrate these resources into their classroom. So recognizing that knowledge mobilization and translation are essential for long-term impact, I developed and distributed weekly support emails to participating educators in these sites. So these emails provided actionable tips, games, ideas related to promoting physical activity, healthy eating, and social emotional development to really ensure that educators have practical and ready to use strategies each week. The emails also featured activities implemented by the educators in their pilot program, so encouraging the knowledge sharing and fostering a collaborative environment across different Strong Start BC sites. The image on the right here is an example of what the cover of the newsletter looked like, and it was built on a software called MailChimp. So monthly check-ins, or what we like to call them community of practice, were also implemented. So this gave the space for our educators to really reflect and discuss and troubleshoot any issues and concerns they had in this pilot. So one thing I learned from this was that most of our sites saw an increase in the children from ages 0 to 3 rather than that 4 to 5 years of age. So to me, that was really shocking. I was expecting more of that 4 or 5 years of range because Strong Start BC is meant to be kindergarten readiness, so you'd expect people right before kindergarten to join these programs, but it was actually quite the opposite. So I needed to cater our games and tips based on this age range. Initially, I was providing games and tips for the 3 to 5 range because that was my assumption, but I was proven wrong fairly quickly. And educators really enjoyed reading those newsletters, and that provided tips on what to do in their sites that week. There was also some major topics that the educators were interested in, and we ended up bringing some experts in on those topics to present in these community of practice. So there was some strong consensus among educators, and they needed guidance on adapting resources for different ages, abilities, and cultural backgrounds. So in response, I curated and shared culturally inclusive, developmentally appropriate activities that aligned with the needs of the diverse classroom settings. So one instance of this was St. Patrick's Day on March 17. So in the healthy eating section of the newsletter, I included suggestions for celebrating the holiday without relying on excessive green food coloring, which is known to have a potential risk for children. To support this, I also shared 2 blog posts featuring natural ways to incorporate greens into food. Similarly, on the right, you can see during Lunar New Year, which is a significant celebration in Chinese communities worldwide, I provided an Appetite to Play resource that emphasized healthy eating while also fostering social emotional development and promoting cultural appreciation. So now I just want to talk about some of the barriers, and in particular, the barrier of lack of resources. And this was found not only in our Strong Start BC centers, where educators identified in the community of practice that they had this issue, but also in the literature across various different programs. So research shows that even access to simple playground equipment such as bikes or play structure can significantly increase preschool physical activity levels. So we thought, what should we do with this information? So what we ended up doing to address this challenge was, based on our budget, we ended up giving a $300 prize limit to one facilitator each month. So there was monthly draws where educators can show how they're integrating Appetite to Play and Feelings First activities into their centers for a chance to win some of these prizes for their centers. So we asked for some of their feedback on what kind of items they would like to see in their sites and ended up compiling a 10-page plus catalog. So here are some examples. You can see for social emotional development, we have some cozy corner pillows, play tents. For physical activity, we have stones, sensory steppers. For food literacy, we have kids' kitchen tools and sets, and we have some Indigenous reflection color books. So this brings me to what I would do differently or the recommendations for the future state of this pilot. Again, this pilot was for the first top most 25 vulnerable sites, but we might be extending to the next 25 sites. So I think our team has addressed that we weren't able to incorporate Indigenous ways of knowing as we like to. So in the next pilot, the team will build relationships with Métis Nation BC and Aboriginal Health Start program, which is a similar initiative as Strong Start BC, to really learn what they're doing with their target population and how we can incorporate some of those learnings to make this program more culturally appropriate and diverse. Another recommendation would be to continue really getting feedback from the educators, which we attempted to do this pilot, but it's very important to continue that in the future pilot state. And then a focus group should be conducted for quality improvement to scale up to the next 25 sites. So I just want to briefly talk about my own personal reflections. I didn't realize how important literature reviews are. Instead of making that mistake and finding out on your own during your project planning, it really allows us to take those precautionary measures to really create equitable access and address challenges and barriers from the get-go. And we have adapted this program so much, like I explained during this presentation, based on just a rapid review. I personally was not a big fan of literature reviews, but this practicum has been eye-opening, and I highly recommend doing literature reviews in every project to really get yourself educated on the topic and learn from it. On that note, I just want to share that this project is being shown as a poster presentation at 2 conferences. So it's already gone to the Children's Healthcare Conference in Ottawa and the Canadian Public Health Association Annual Conference in Winnipeg. And I have my name up here. Sorry, it's a bit blurry, but it's a very huge accomplishment and recognition of the work that went into this project. And I'll allow it for some questions.